People get this impression, oh my gosh, it's my ovaries are just malfunctioning.
It's like a blame game that we're blaming the ovaries when really there's so much more that encompasses PCOS.
So it is something where people can have multiple hormone conditions all at the same time.
Hi, I'm Dr. Jessica Shepard, Chief Medical Officer at HERS. You're listening to the HERS podcast, where we discuss everything women's wellness. And my guest today is a board-certified gynecologist and surgeon, an author, and a major voice in the reproductive health space, Dr. Karen Tang. I am so glad to have you here, not only because you are formidable and you're one of my colleagues, but you're also one of my dear friends.
That's right. I'm so excited to be here.
Both of us have been in the space of gynecology for so long. What would you say in the space of women's health that women really are missing out on?
Oh, so much. I mean, I think this is really exciting in this moment that people are talking about things like hormones, PCOS, perimenopause, menopause is huge, general wellness. I think it's so much that over the years, we thought that these things were embarrassing or that's, it's not important to talk about these things. So I think it's really revolutionary that women are kind of taking control of these topics and wanting to learn how to best take care of their health.
I think that you hit it on the head there, that they want to know more about themselves in order to empower themselves. And now bringing it to some of those topics, which I'm sure you and I have talked to many patients about when they come in, which can be confusing, is PCOS. And PCOS is one of those terms and conditions that many people hear about, not quite certain of exactly what it is. So I'm going to throw it right back to you and ask you, what is PCOS?
And PCOS is one of the probably the hardest conditions to explain. And so I was thinking to myself, how do I explain this? It's not one disease or condition.
But tell us what it is in full terminology.
All of it.
We're going to get you down to like the layers of PCOS.
Yes.
Yeah.
So polycystic ovarian syndrome. So it is a condition that's characterized by hormone imbalances. And that can lead to a lot of different things in terms of period health and fertility, and also a lot about metabolic health, weight and insulin and blood sugar, and also your skin. It can cause things like acne and facial hair. So when I explain PCOS to patients, I always have to say, it's not, like I said, it's not one condition. It's not like diabetes. It's not like, a heart attack. Someone with PCOS can have very, very different experiences to, 10 other women who have PCOS. So I always say you only have to have 2 out of 3 things to be called, to have what we call PCOS. One is missing or very infrequent or irregular periods, because a lot of people with PCOS don't ovulate regularly. They don't release eggs regularly. And so if you don't, then you may skip periods. The second category is signs of excess testosterone. So you may have things like the acne, the facial hair, excess body hair. And then the third thing is on an ultrasound, you may see what we call polycystic ovaries. And this is actually something that's very important to talk about because people picture like giant, like there's huge balloons like in your pelvis. They're actually really tiny. So they're basically the follicles where your eggs are developing in your ovaries. Your body's trying to get you to release eggs, stimulating your ovaries, but they're not quite getting released. So you see on ultrasound all these little tiny dots. We call it like a chain of pearls. And you can see those on ultrasound. So you only have to have 2 out of those 3 categories to be called PCOS. And of course, we would rule out other things like thyroid problems or, other hormone problems. So a lot of people are confused because you can have PCOS and not have polycystic ovaries.
Exactly.
So it's a terribly named condition.
In all the patients that I've seen, I think the name of the condition is the most confusing. And actually, really, it's like a blame game that we're blaming the ovaries when really there's so much more that encompasses PCOS that women sometimes feel a little bit defeated when they get that diagnosis, is because it has to do with the reproductive system. And I think when we think of the reproductive system and anything that may fault the reproductive system, that's where women may feel a little bit ashamed, maybe even not empowered by their body. And the real thing is, just like you said, it has so much more to do with so much other parts of the body that we really shouldn't limit it just to the ovaries. How do you expand that that diagnosis when they come in so that they don't feel shamed of their reproductive system?
Yeah, there's so many things you just touched on. One is that it's not that your ovaries are broken. People get this impression, oh my gosh, it's my ovaries are just malfunctioning and that's why my hormones are off. First of all, no one really knows where PCOS comes from, but more and more we're starting to understand it as having to do with something to do with metabolism. So insulin, blood sugar levels. Something like 75% of women with PCOS will either have insulin resistance, pre-diabetes or diabetes at some point in their life. So we do think it has something really closely tied with their metabolic systems. And also people will find this out because a lot of times they may have difficulty losing weight. That may be one of the first things that they notice. They're gaining weight no matter what they do. They can't seem to lose the weight. And again, it's not because there's something that they're doing wrong. A lot of times women may get blamed like, oh, you just need to exercise harder, want it more.
Meanwhile, they're probably exercising 6 times a week for 2 hours a day and still not really looking at why this is happening and what they're doing is failing. So that can be a little bit of an imbalance between the actual diagnosis and what really needs to be done in order to offset some of the symptoms that they're having. Now, when we think about women and how many are actually impacted, how do we look at that from a statistical standpoint?
It's extremely common. So it's one of the most common, if not the most common, endocrine or hormone conditions of women of reproductive age. So it's something like up to 10% of women. So it's millions and millions of women and people assigned female at birth who have PCOS. And we actually think that a lot of people don't know it yet. So there's some estimates of, something like 70% of people with PCOS may not actually even know that they have it yet because, they may not necessarily realize it's a gynecologic condition.
So that actually is impacted because of period culture in general. And that's a global thing, not just, to the US, is when there's something wrong with someone's cycle, it can elicit feelings of there's something wrong, I did something wrong, I may not be able to get pregnant, so I don't even want to find out, and then I don't want to tell anyone. And so when you have patients that come into the office, you said it when we started that you can have 10 women walk in and 10 women have different stories. What are some of those stories that you hear from patients who are walking in?
Exactly. And so, everybody, the thing that brings them finally to the doctor may be so different. One person may have just the crazy periods. They may be skipping periods. When they finally get a period, they may be bleeding all the time. That's actually a very common pattern, is that if you've gone 4 or 6 months with no period, when you finally get it, it's almost like having 4 to 6 months worth of periods all at once. Really heavy, lasts a long time. Somebody may come in because they've been trying to get pregnant. If you're not ovulating or releasing eggs regularly, it can obviously make it difficult or impossible to get pregnant. Someone may come in because of the weight issue. I'm doing everything possible. I'm exercising like crazy. I'm doing everything in terms of a healthy diet, and I'm still gaining weight. They may come to their dermatologist and say, oh my gosh, my skin is crazy. Like I am breaking out and I have all this facial hair. So what brings people to the different doctor, like I said, may be so different from person to person.
Yeah, and the work that I, do with patients as a gynecologic surgeon, a lot of these patients were coming in because of fertility issues and saying, I can't get pregnant, or I've been to an infertility specialist or another OBGYN. And sometimes the focus can be on something else because we maybe want it to be something else, when really it could be PCOS that's just not maybe appearing in the classical form, or maybe there's a part of the story that's missing. But PCOS is so common, and I think that once women understand that they're not alone, then they really can see themselves and feel more reassured.
Exactly.
So the name PCOS, polycystic ovarian syndrome, again goes to ovaries. But you already said that so many of your patients come in for something that may not have to do with a cycle or a period, but weight gain. And no matter what age or stage a woman might be in, that's one of the things I see that impacts their life. So when we think of PCOS, obviously we've said it's a whole body system issue. What would you say from a nutritional standpoint is some of the key things that you talk to your patients about?
Yeah. And this is something that's differed over the years. I think when we were training, there was such an emphasis on periods, on ovulating and fertility. And now we know so much more about the impact with blood sugar levels, insulin resistance, wellness, et cetera. It's about, you just nailed it, whole body management, about, nutrition, about exercise, et cetera. Now we know a little bit more. Somebody with PCOS, especially if they are overweight or obese, may benefit from something like a low carb diet, that we may need to kind of watch the glycemic index of the foods that they're eating. I very often send my patients to see a registered dietitian, at all different weights. It's not about just losing a certain amount of pounds. It's about making sure they're eating a balanced diet, that they aren't accidentally, spiking their blood sugars and things like that. So it is a very important part of how I talk to my patients and about the team that we assemble to help them achieve those goals. So very common that I'm sending them to a registered dietitian to kind of help figure out, what they should be eating, what kind of sneaky sugar pockets are in certain foods that they may not realize, and that sort of thing.
And I do the same thing. I send them to a registered dietitian because I want them to get the expertise based on their body type, their body frame, maybe ethnicity, but also maybe the foods that they're used to, where you can still have, a curated diet that is within the foods that you like, but just tweaking it just enough. The body really is and thrives to be this well-oiled machine, and that doesn't necessarily mean that it has to look a certain way, but it does like to function a certain way. And internally, the more I teach my patients about what's going on internally and having them kind of connect the dots, makes them want to be able to do the work outside of the office. You and I see patients in the operating room, in exam rooms, and back in the day, in labor and delivery rooms, not so much anymore. But outside of those rooms, it really is giving patients the agency to say, okay, now what can I do outside of the office or the operating room that I can take control of my life? And nutrition is one of those fundamental things that they ultimately have the power to change and then see how their health can actually be at their best. And with nutrition, obviously hand in hand goes exercise. So nutrition and exercise are those things that are going to optimize our health and things that people can do outside of the office. So when it comes to exercise, what do you tell your patients?
Yeah. And so really quickly before we jump into the exercise, what you said about making it sustainable for someone's life. I think in the past, we used to have such an emphasis on like the weight and the certain number of pounds, or, do X, Y, and Z regimen or eat certain amounts of calories. Now it's about making sure that, it's healthy, it's sustainable, it fits their life. Because like you said, like different people like eating different foods. They, like have certain, preferences for things. So it's all about sustainability and health. So same thing with exercise for, people who are wanting to lose weight or just to kind of get healthy in general. We obviously have a balance of, your cardio for your heart health and maintaining your metabolism, strength training, and building your muscle. A lot of times people forget the strength training part.
Yeah.
They're so focused on cardio and just revving their heart rate. But obviously you have to pair it with maintaining your muscle. Muscle that also maintains your metabolism. So actually, since you're the fitness expert, I would love to hear how you counsel your patients about exercise and PCOS.
Well, I'm glad you think I'm a fitness expert, but I'm really not. But I do love exercise, and I do spend an exorbitant amount of time talking to my patients about exercise. And when we're talking about PCOS, you said one thing that's like vital to how we utilize glucose is our muscles. And strength training is going to build your muscles. And we know that muscles really absorb the most glucose out of our body anyway. So the more that we do strength training, we're going to absorb that glucose, which is going to help the body utilize it and get it to where it needs to be. And then decrease those blood glucose levels, which again is kind of like that axis on what PCOS rotates around. So I love to tell my patients, what do you like? I always put it back into their lap and saying, one, what do you know about exercise? What do you hate about exercise? And then let's find something that's going to work for you. Let's find new things that might be appealing to you. And the sustainability part is probably the most thing that I focus on, because it's not about where are we going to be in 3 months. I want to know where you're going to be in 30 years. And if we can start something slow and easy and something that you can work into and that you enjoy doing, the more likely that it is that it's going to be sustainable. I do think we spent a lot of decades focused on women and exercise being more cardio focused, and men could only do weight training. And now we are seeing with women's body and physiology, especially in mid-age, as we start to increase our age, we're going to become more insulin resistant. Glucose is not going to be shuttled where it needs to go. And specifically with PCOS, that's what it thrives on. It's really waiting for glucose to hang around. So we want to get it out of the blood and get it into the muscle. So strength training is one of the most beautiful things that someone can do. So we have to find ways to make it more appealing.
It something that they could love. Exactly.
Now, in addition to that, so now we have nutrition and exercise, but as physicians, our kind of appeal to how to make people better comes with medications. Medications do work. Medications are not needed for everyone, or not everyone has to take them, but there is very good utility to what medications are and how they can provide, a really fundamental basis for people to be better. PCOS and medications. What are some medications when we talk about weight loss medications and when we talk about glucose?
So obviously, nowadays everyone's talking about the GLP-1 medications. And so, again, you can kind of think of them almost as if they were for diabetes, but they also work in other different ways besides, blood sugar management, also about, the motility of your gut system and also feeling full and satiety. So they work in lots of different ways. Like you said, it's not that obviously we don't think that everyone needs medications, but for those people who have optimized everything else in their control. So they've watched, what they're eating, they've worked with expert, registered dietitians on nutrition, they've, really kind of fine-tuned their exercise regimen, and they're still needing that extra help. So that's where the role of medications comes in.
Yeah, GLP-1s to me are this formidable, revolutionary, innovative way of using medications for so many different features. Now, you and I, when we practice, we use medications for other things, even though they may be intended for one thing. But GLP-1s is kind of like that groundbreaking medication that now we're seeing impact so many different organ systems. We have seen that it obviously helped with diabetes. We've been using those for decades, but now with weight loss, quieting that food noise, again, improving our satiety so we're not intaking as much as we used to, which is going to help with decreasing the amount of calories that we intake. But also it helps with glucose utilization. What are we seeing now in research? We're seeing how it's impacting heart health, sleep apnea.
I was just about to bring up sleep apnea, as now it's indicated for sleep apnea, which we haven't even touched on, but sleep apnea also influences things like your insulin levels, your cortisol, your weight balance, and that actually is really key. So again, it's not even just working on the blood sugar, but all of these other features.
And I think that we are starting to see in medicine in general what the body is that it's all connected.
It's all interconnected.
And how we were, taught and how we actually inform our patients and educate our patients used to be so organ-based and so system-based. But now that we're exploring and expanding and how the body all works in synchrony and how it wants to work together, I think is where we're going in medicine. That's the future of medicine and wellness and longevity, is how can we make sure that people understand this impacts this, and when I make this better, this will become better. And PCOS is one of those diseases and syndromes that we see, if I can change this, then my ovaries might change this, or my heart health might change this. And so that's what I love about this education, is that we have come such a long way when we think about what we learned in the textbook about PCOS. How many years ago? We won't say how many years ago. We're not going to tell everyone how many years ago. Up until now.
We are seasoned
we
doctors.
are seasoned doctors. But now what we're seeing with PCOS, to me, is so much more reassuring and makes people feel that it's not just a reproductive health issue.
Exactly.
Now I'm going to go to rapid fire because I want you to be on the spot.
Oh, goodness.
And when we're talking about PCOS, I want to know, what are the most common reasons patients seek you out to help with their PCOS?
So probably the most common is the period problems. So, being a specialist in things like, endometriosis and fibroids and cysts, I think people think to come in to see me about the period stuff.
Yeah.
So, my periods are missing, I'm bleeding all over the place. But, for a long time, I've worked hand in hand with fertility specialists. So a lot of them do actually come in for the fertility aspect of things. And then, like I said, more and more recently, because I've seen a lot of patients who are, concerned about midlife and perimenopause and hormone changes. I think that, knowing again that this is so much more complex than just like a make you ovulate kind of condition.
Yeah.
I think it's really exciting to talk that through with patients.
Yeah, it's a lot of overlap, but it's all body encompassing. Here's another one for you. Another concern for many women, besides the weight gain, which we touched on, can PCOS cause hair thinning?
It's possible, though we say that not everything that is high testosterone is PCOS. So we actually, if you have really significant hair thinning, almost like kind of balding in areas, that could actually be something else. Some other condition like an adrenal gland issue or skin issue. So that's something where you may want to see a dermatologist or your primary care doctor to, figure out if it's something else.
Yeah, it's all multidisciplinary, and sometimes you have to bring in other experts in order to figure out what's causing the issue. Okay, can we go a little bit deeper on some of the specific symptoms that come with PCOS, because there's so many that come. Tell us a little bit more about acne or oily skin.
Yes. And so the excess testosterone or the effect on your body of testosterone can cause you to get really like kind of significant acne, cystic acne, the oily skin, and some of the hair changes. So there's a few things that we can do for that. One thing is actually giving birth control, believe it or not. Estrogen in birth control drops testosterone levels. And there are certain types of birth control pill where the progesterone hormone actually further decreases testosterone. So it's actually not uncommon for dermatologists to send patients to a gynecologist to help with their acne. A lot of people don't realize that, even if they don't have PCOS. And then there's some other things that can be done for the acne. Obviously, you can see a dermatologist and talk about different treatments. And then there's also another medication called spironolactone, which can decrease testosterone and is used for acne as well.
Yeah, so a lot of different things that can help, but that is the reason why we have that is testosterone. Now, hyperthyroidism.
So PCOS, a lot of people don't know this, is connected with a lot of other endocrine or hormone problems. So it can actually increase your risk of, or it's associated with increased risk of not just hyperthyroidism, where your thyroid is overactive, but also hypothyroid, where you can have low thyroid and like slower metabolism and skin changes, especially in things like autoimmune conditions like your Hashimoto's and Graves' disease. So it is something where people can have multiple hormone conditions all at the same time.
That's what I like to say about hormones. They all live in this little community, a gated community.
They're neighbors, yeah.
And when someone is acting up, you're like, when someone has like the bad lawn and you're like, they didn't cut their yard and then it kind of goes on to the other yard. It's kind of like one hormone may impact another hormone because it's not acting right. And so not everyone is going to have a thyroid issue or acne or oily skin, but it can because they're so closely related and they all really live in close proximity to each other. Now, hormone imbalances, which obviously PCOS is going to impact, hormone imbalances, when you try to explain that to patients, what are kind of the key things that you like to tell them?
Yeah. So when we think about the menstrual cycle, what typically happens in a cycle, normally you will ovulate, you release an egg, and that actually will release a hormone called progesterone, which is actually super important. It actually helps to control the lining of your uterus, keeps it from growing too much. And it's actually also the timer that gets you to have a period on time. So if you don't release an egg, you don't have that progesterone, you don't activate the timer, that's why people start to skip periods. So, when we say that someone has a hormone imbalance, it's not just we've talked about testosterone being high, we've talked about insulin levels being high. You can also have your ovarian hormones be off kilter. So most people with PCOS who are having the problems with their ovulation will have, like I said, this missing period issue. And then when they finally have their period, they may have lots of bleeding because progesterone also controls the tissue that grows and the amount that grows. So sometimes you get this really big buildup of tissue in the uterus and you can bleed a lot. You can have problems, even like uterine precancer or cancer.
Right.
So sometimes there's really significant health risks that come with PCOS.
Yeah, and that's why it's important to go see your gynecologist and make sure, even though you have regular cycles or if you don't, to make sure that you're following up on that.
Exactly.
And our last rapid fire, what is moon face? I see this a lot on social media, but we want to hear it from the doctor. What is moon face?
So literally where your face looks really round. Now, I'll actually say that's usually not PCOS.
Right.
We associate that with other hormone conditions like Cushing's disease, which is high cortisol.
Now, PCOS, we've given an overview of the condition, what causes it, but it impacts your health, but also your daily life. So would you say that PCOS causes fatigue or feeling tired?
It's possible. It's not one of the symptoms that we think of very commonly, but if someone, say, has like sleep apnea, they're sleeping poorly, it's possible.
And I think that some of those changes in the hormones can impact sleep and then causes fatigue and how people are able to perform daily. And also inflammation. We hear a lot about inflammation and how our health impacts inflammation, which is very true. What would you say about PCOS and inflammation?
It's possible. It's one of the things we don't know that much about, but I will say kind of like, empirically or word of mouth, I've had some patients say that with maybe changing their diet to have less inflammatory foods like red meats, like sugars, that they do feel better.
Yeah.
So it is possible.
And inflammation is definitely attributed to a lot of how we feed our body, what we fuel our body with. So I think that, again, is that overhaul of nutrition and how it impacts inflammation. Now, you touched on this before, but mood swings. How does PCOS impact mood swings?
Yeah, it actually is associated with increased risk of depression and anxiety. And the way I explain that, we don't actually know chicken or the egg. Does it cause depression and anxiety? Or because it is literally touching on every aspect of your health, does it increase the likelihood that you will feel depressed or anxious because you're dealing with so many health issues? But for people with PCOS who feel that, it's not in your head. It truly is associated.
Yeah, I see that a lot with a lot of reproductive health issues can lead to, like you said, chicken before the egg, a lot of mood swings, and then also impacting our mental health. How do you talk to your patients, or how do you kind of make them understand the connection between mental health and PCOS?
Yeah, it's so important. One is just to bring it up, because I think a lot of people don't think to bring up their mood or their mental health, but it is so important because it touches on all of these things, your ability to take care of yourself, to exercise, to, watch what you're eating. All of these are tied to your mental well-being.
Absolutely. And I think that once we're able to understand mental health and its importance in overall physical health, the two are very related. And so patients actually do feel better when I bring it up because they don't feel as if they are scared to bring up mental health issues. So it's a very inviting question. Now we're going to touch on PCOS and pregnancy, where I know you and I have spent many of our visits and encounters with patients because PCOS impacts pregnancy. So can you get pregnant with PCOS?
Yes, you can. And so it may make it more difficult if you are skipping periods, if you are not ovulating regularly. But there are a lot of people with PCOS who have perfect periods. They're ovulating every single month. So this is where we come into the every woman is different. So it is something that can be a very common cause of fertility problems, because if you're not releasing an egg, you can't get pregnant that month.
I wanted to emphasize that first part of the answer that you said, yes, you can. Because many times what people may read or see, they come into the office with the notion, if I have PCOS, or if that's the diagnosis, or if I've been diagnosed with it before, now I can't get pregnant. And so most of the time that I spend with patients is reassuring them that that does not mean that they can't get pregnant. And so I see a lot of tears. I see a lot of relief, sighs of relief when I explain that to patients, because that really is the fear that they came in with, is that because I may have PCOS, then I can't get pregnant. Now, if someone does have PCOS and does get pregnant, can it impact their baby's health?
So it does increase your risk of things like insulin resistance and diabetes, which in pregnancy can mean an increased risk of gestational diabetes, where you have higher blood sugar in pregnancy. And that can definitely impact, the health of the growth of the baby. People can have a slightly increased risk of things like birth defects if it occurs early in pregnancy. And then later, closer time of delivery, it can increase the risk of things like C-sections.
Yeah. And that's a lot of what we saw when we were delivering babies at the time, is if someone has that diagnosis of gestational diabetes, that we really have to watch those patients and the growth of the baby, and also for the delivery to make sure that there was a safe delivery. So it definitely does impact both mom's health and baby's health. Now, what are some myths about PCOS that you want to bust? You can do it right here on the Hers podcast and bust all those myths.
So important. So actually, that fertility one is probably the biggest, because patients are either sometimes they're told, or they kind of hear this message that you are infertile, like you cannot get pregnant. That's usually not true. And also, this becomes important. People may have heard of the term Ozempic babies, or where you may have had difficulty with ovulation and trouble getting pregnant. Sometimes with those weight loss, with things like GLP-1s, they actually start to ovulate regularly without realizing it. They may get pregnant without intending to. So it is very important that people don't get that message like you cannot get pregnant both in terms of, not discouraging people, but also not giving them a false sense of, oh, well, I don't have to worry about birth control because I've been told I'm infertile, because oftentimes that's not the case.
One other myth that I've heard, and I wanted you to comment on it, is if you have PCOS, that you are obese. Can you bust that myth?
Yes. So we used to call it lean PCOS, where someone didn't have the obesity, the overweight, but still had the hormone imbalances. So, a fair number of people with PCOS do not have a problem with weight, but they have everything else. They have the issues with ovulation and the insulin resistance.
And that is another thing, is that sometimes even I, from a bias of a medical professional, because of how we were taught about PCOS, the greater percentage of people who have PCOS might be overweight and or obese, but there are people who are not any of those who have PCOS. So a lot of times there would be patients, early in my career who might come in and you're looking for that perfect list, that diagnosis, and they may not fit that category. And so obviously, as you practice more, you see more patients, you start to see that that doesn't necessarily correlate.
A lot of people, that delays their diagnosis too. I found a lot of patients, who are slim and they've gone to doctor after doctor being like, what's going on with me? And you're like, well, you clearly have PCOS.
Right.
But, other doctors may not have even thought of it because they're sort of envisioning someone has to be a certain, weight, a certain body type.
When we think of diagnosis and treatment, how do we diagnose? And you touched on some of the signs before, but can you go over that again and maybe include some of maybe the lab work that may be included when we're talking about diagnosis of PCOS?
So first we take their history. We talk to them about their periods. We talk to them about symptoms like skin conditions, weight, etc. And then we may get blood work done to check their hormone levels like testosterone levels, their estrogen levels. We want to rule out things like the thyroid issues that could also be causing period problems and fertility problems. So those are commonly the blood work labs that we're checking. We'll also probably check things like your cholesterol, your blood sugar tests, because we want to look at those other conditions that come along with PCOS. And then we may get ultrasounds to check for those polycystic ovaries. And also, if someone's having those bleeding issues, we want to check for other things that can cause bleeding problems.
Now, when we talk about misdiagnosis, is PCOS ever misdiagnosed, or could it be mistaken for a different condition?
So anything that can cause the testosterone to be high can cause very, very similar symptoms. So for instance, if someone has an adrenal gland problem, there's certain hormone problems with that can mimic PCOS. Or like we mentioned thyroid a couple of times, that can throw off your weight and your skin and your periods and all of that. So there's a lot of overlap with some of these other hormone conditions.
I think the hormone, we talked about it, the community, the neighborhood, a lot of overlap. And so it's important from a medical professional perspective to make sure we're not missing something. And so that's why a lot of times it can seem overwhelming for a patient who comes in with potential PCOS as a diagnosis, is that we have to actually look at a lot of other things to make sure that nothing is being missed. So have patience with the doctor.
So we've talked about it a few times in terms of just wellness, lowering the blood sugar and lowering the insulin levels. Sometimes we'll actually automatically reverse some of the hormone imbalances. So again, we used to kind of talk more in terms of pounds, like lose a certain number of pounds. Now it's not so much that as, watching things like your blood sugar and exercising and, taking over kind of just overall wellness. Sometimes that will actually reverse the hormone imbalances. And sometimes, you're factoring in some of the medications like metformin or GLP-1 can actually more directly change the hormone imbalances. So it is something that we talk about, all of these lifestyle changes as quote unquote natural ways that sometimes you can treat PCOS.
I'm glad that you put it in lifestyle as that category, because really the body and the treatment of so many conditions requires like this symphony of different things. It's never going to be just one thing. Someone may respond to a medication differently than another person, but ultimately, when we have that underlying foundation of nutrition and exercise and mindfulness, that actually is going to carry so much weight of how their body responds. And I think that that's where we are again, going in medicine, which I'm very glad that we're doing that because it actually takes the pressure off of the doctor and the patient to adhere to like this one thing that has to be done or this one organ system that has to be perfect. It really is kind of across the entire body, but also across lifestyle as well.
And something that I wanted to bring up, we brought up like the idea of shame or blaming a few times. I do want to point out, for people who may have heard like, well, if you do this right, you're going to reverse all of your PCOS and you will never need a medication. That is so harmful because people then blame themselves. Like, I didn't exercise hard enough. I didn't fast or do the special kind of secret sauce. And I think that is, something that really is kind of putting boundaries to actually getting treatment because people think that, well, I failed, like I didn't do it hard enough. So this is where we say, medications sometimes come in like that we do need to give sometimes birth control or other medicines that actually will help out because you kind of take it as far as you can within your control. And then that's why medications exist is that you may need them. It's just like, for cholesterol, like some people will need to take medication for cholesterol. So just like someone might need medication for their cholesterol or their type 2 diabetes, they've maximized their, nutritional status and their exercise, but they may need medication to help take them that extra step.
And leading into hormones, I love to talk about hormones and hormone replacement therapy. But what is HRT?
So hormone replacement therapy, usually when we say that, we're talking about for perimenopause or menopause. So people think about estrogen and or progesterone to help with things like, not just like hot flashes and night sweats, but all of these other symptoms that come along with perimenopause, menopause, vaginal dryness, bladder issues, low libido, et cetera.
Now, when you talk about hormone replacement therapy and PCOS, do you think it can help PCOS and in what ways?
So PCOS is something we're learning about more and more, how does it interact with perimenopause, menopause? And we don't have great answers yet. I think that's something where the answers are still to come. But things like the hormone replacement therapy can help with like evening out levels of hormones. The progesterone in HRT can help with some of these symptoms like, the irregular periods, the mood fluctuations, et cetera.
I love that you talk about the mood because a lot of people don't attribute mood to hormone imbalances, and bringing that back in is really, really key so people don't feel alone or unheard. Now, HRT has gotten a lot of bad rap for maybe the last 20 plus years. Just quick question, is it safe?
So this is something that, yes, it is overall very safe, much safer than we previously had said that it was. So, now we know, especially when you look at younger women, we're in our 40s, 50s.
We're those younger women.
We're younger.
We're the younger women.
So women in their 40s and 50s who are oftentimes the ones who really need the HRT for some, really extreme symptoms, have a much lower risk of things like breast cancer automatically. So, it is much safer than we had previously thought. And especially when you look at different types of HRT. So, we could do a whole episode on just that, but very important to look at, the different types of HRT. Vaginal estrogen is way less risk than almost everything else. And of course, we personalize it to the person. So if someone has a really, really high risk of breast cancer, we treat them a little bit differently. But like I said, we always have to center the patient. We have to be more nuanced.
Now, shedding light on progesterone, we talked about how HRT might be helpful for PCOS and the progesterone levels. Is progesterone the hormone that's being replaced? How does it work and how often do you give it? Do you give it cyclic? Do you give it continuous? What would you do from a hormone replacement standpoint of progesterone and PCOS?
Yeah. So progesterone for HRT, we oftentimes will think of it as a protective effect. If you give estrogen, which is really, really good for your hot flashes and night sweats and brain fog, if you give estrogen by itself, it can actually increase your risk of uterine cancer. So a lot of times for HRT, we're giving progesterone to protect your uterus, but it also has a lot of benefits in terms of sleep. That's actually a huge one. Progesterone, which we often give for HRT, is really good for helping people sleep, which again can help with so many other health issues. So we give it usually once a day at bedtime. For someone who hasn't fully gone into menopause yet, we may do it cyclically, meaning that you might take a break, give yourself a period. But in general, we can also give it every single day.
I tend to do both depending on what the patient's looking for. Continuous seems a little bit easier because then you don't have to forget when to take it, but both are really, really helpful. Now, do people normally do HRT during perimenopause?
Yeah, so this is something, again, that we're raising awareness about. In general, we ask about symptoms. We see if they have things that we need to treat. But also now a lot of people are looking into, is it helpful for prevention? Like we know that HRT in younger women is cardioprotective. It can decrease their risk of heart disease. So again, we're gathering more data, we're learning more and more, and then we're listening to what women are looking for in their own health, and then we help them decide.
I'm really glad that we're at that point, especially seeing HRT from the days of when it was scary and to now just how beneficial it is. It really is helping women with their lives currently with symptoms, but then also looking forward at some of those conditions that we can actually help prevent. So what can people expect when they do HRT?
So obviously, we kind of try and manage expectations. Like there are sometimes people almost look like it's like a magic wand. Like you take it and like you're rejuvenated.
Right.
There are some things that do respond relatively quickly. So things like hot flashes, night sweats, within a couple of days, you may feel better or they may disappear. Some of the other issues like mood symptoms, libido, weight, like that can take a lot longer and they may or may not improve. So we always tell people it all depends on the person. You have to kind of give it a shot. There are sometimes it can take 1 to 3 months to kind of feel the optimal effects. Some things, like I said, you may feel a lot sooner. So it is about kind of managing expectations, like kind of knowing that it's not a magic wand, it's not instantaneous, but some of it is over a long time. It may help to kind of preserve your health, or like start to kind of change some of those symptoms. Your skin, your muscle, your bones. Those are obviously much longer term.
I think everyone comes in with a different laundry list, so you have to manage expectations, but also that this is the long game. Like this is your life. It's not just tomorrow you're going to be a completely different person and feel completely when you were 20 years old. That's not even the goal. The goal really is how can we make your life where you are right now better, and how can we improve some of the outcomes coming down the road? Are there any negative side effects like acne, fertility issues, or weight gain when we think of HRT?
So usually for HRT, we aren't giving it to somebody who's trying to actively get pregnant.
Right.
So it's not as effective as birth control. It's actually weaker versions of the hormone.
Much weaker.
So we do tell people it's not a birth control. There are sometimes we will use birth control as HRT to give someone hormones if they also want to stop ovulation and preventing pregnancy. But in general, it also, the bigger kind of risk factors we think of are things like, breast cancer. If someone, has a history of breast cancer themselves where their body responds to hormones in a negative way, that may be somebody that we obviously cannot give systemic HRT to. If someone's had an actual blood clot in their veins or their lungs, we can't give them HRT with estrogen especially. So there's something, like I said, we have to kind of personalize it to the person, but it actually remarkably has relatively few side effects compared to birth control, which people may be scared because they maybe took birth control pills and had a lot of mood symptoms or, acne or skin issues. They may think the same about HRT. I do find, and you probably do too, people tolerate it much better because it is a weaker version.
It is just a low level, and it's really there just to kind of create this nice buffer rather than the higher levels that we see in birth control. So as we are kind of wrapping up and getting towards the end, which I'm very sad because I love sitting here and talking to you.
We could talk forever.
I know, we really could. Is what are the next big things that, from your perspective, you see in women's health?
So I think just the raising awareness of everything, I think is so key. It's led to increased funding for women's health research. And just like the advocacy that people are doing is super exciting. Because, we were kind of joking before the podcast, are there great women's health innovations? No, I think women's health in general has been very neglected. But just the raising awareness and putting the pressure and like showing the need for innovation, I think is probably the most exciting thing.
It is. It's kind of like raising awareness, having that billboard sign and letting people know that this is something that's important and impacts half of the population. Half of the population are women.
It's so literally half of human beings.
Probably pay attention to them. When we think of innovations in PCOS treatment, what are you excited about?
So actually the GLP-1s has been kind of a game changer, especially for those who have struggled, they've done everything right. They just kind of feel like defeated, like, no matter what I do, I'm kind of not making any sort of difference. You really see that transformation. So again, it's not about just like, we give it to everyone or use it like kind of, too casually. But it is really exciting to have this option for people who just need that extra step.
I think that when we typecast past medications to a certain diagnosis. That's where we have issues with helping people understand just how much it impacts from a GLP-1 perspective, the rest of the body. So for me, PCOS, as soon as I started to see some of the best utility of GLP-1s, I was like, I bet that this is going to be something that can really be in the PCOS world as far as a treatment. How are things changing in the way that we discuss PCOS? You made a nod to it about increasing awareness, but what would you say about bringing awareness and changing how we discuss PCOS?
Yeah, the aspect of the metabolic health, that again, it's not just about like periods and it's not just about your ovaries, about, your overall health and how it's tied to, your insulin levels, weight management, energy, all of those things. So I think just kind of like changing the framework of it has been so key. And there's more and more research now about things like, like low carb diet, what are the differences that, like your nutrition is going to make. I think like kind of taking that different lens of it and kind of zooming it back out to kind of take the whole person into consideration.
I think that there is such a different perspective on health, individuality of it, personalized.
Personalized, yes.
Personalized, and then also from a women's reproductive standpoint, because it was this expectation of you're a woman, you should be able to reproduce, and then that was the end story. And there's so many kind of obstacles or changes in the path as one is going through their entire life cycle as a woman that we really needed to not just place people in a box, but we needed to be able to say, if you're having these issues, let's really take a step back and understand you as a person, but also how to create more empowerment within women so that they can navigate those journeys in the best way that they can. So as my colleague and friend, I'm so glad that you've been on the HERS podcast today. I want to make a very strong nod to your book. It's Not Hysteria.
So it's not hysteria. Everything you need to know about your reproductive health, but we're never told. So it's basically everything you could possibly think of, all the things we've mentioned, PCOS and fertility, periods, perimenopause, menopause, HRT, any question you may have had, it's in there.
Because a lot of what we have spoken about really is covered in the book. And I feel that, when you called me and told me that you were writing a book and what it was about, it really was a beautiful blend of looking at all the conditions that impact women in their reproductive health, but also taking away the shame of what they feel when they either are diagnosed with something or they feel that they may have a diagnosis that's pending. What would you say led you to write about reproductive health issues in that manner?
The book led kind of naturally from seeing women in the office and hearing their stories about how they've struggled, they've tried to find information. Sometimes we're shamed for some of the concerns that they had, or we're told that they were overreacting. So I just wanted to make sure that people had access to all of the, data, the information, and also to get information about how to advocate for yourself, because that's the important thing, is not just giving you information, but also how do you take this into your real life and your interactions with your doctor and finding answers for your health.
Right. Finding answers, taking out the shame, but empowering them as well to be their best advocate.
Exactly.
So, Dr. Karen Tang, thank you for being on the HERS podcast. This has been an enjoyable moment because we talk so much off podcast, but now to have you here, I'm so glad you're here, and I hope that we can do this again.
Absolutely. This has been fantastic. I always love talking with you, so we'll definitely need to do it again.
Thanks for joining us for this episode of the HERS podcast, where we talked about PCOS with Dr. Karen Tang, learning about what exactly it is, what the treatment is, and how women can feel empowered in the diagnosis of PCOS. You can learn more about PCOS and other women's health topics at forhers.com. And to our listeners, stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.